And John, I'm very pleased that you're here, and I'd like to have you go over just basically, how you presented to my office with a full denture, the problems you were having with it, and then let's just go over the actual day that you had your teeth placed.
Sure. First, let me thank you for inviting me here. I'm pleased to have the opportunity to talk about my experience. As you know, Dr. David, I've been a patient of yours for 10 years or so, and I've always been extremely anxious about dental procedures, everything from simple cleanings to periodontal work. So when I made the decision to move from a denture to the implants, I knew that it was going to be a difficult decision for me based on how anxious I am about the process. But having had the upper removable denture for a year, I knew that it was something that I would not be able to use long term. With the placement of that removable denture, I immediately saw a difference in my sense of taste. I saw that my speech was different. Just a lot of challenges in trying to get used to that. So when the opportunity came up to talk to you about permanent implants, I was truly excited, but at the same time very anxious. So we moved ahead with the procedure, and on that day, just to recap my experience, came into your office in the morning. Immediately felt very comfortable thanks to yourself and the great team you have in place there. Immediately comfortable, and fortunately there's little that I remember between the time we started the procedure and the time that I left later on in the day, and I say fortunately because it was quite extensive, the work that needed to be done. But the experience, having left your office later on that afternoon and being aware of how I felt, I was very, very surprised by how easily the entire procedure went.
Tell our audience, if you would, basically the level of the discomfort you had the next day, what kind of pain pills you had to take.
I'm always reluctant to take any medication unless I truly need it. But the next morning when I woke up, other than some very general soreness, and I say soreness, not pain, I was very comfortable. And I took 2 ibuprofen early in the morning. Yes. And seemed to relieve that soreness, and didn't need anything after that.
We did minimally invasive surgery in your case, and part of the show is to show our audience how we do minimally invasive surgery with an in-house 3D CAT scan machine, where we actually take a 3-dimensional scan, which we did in your case, and then we actually go, and it's a computer program where we, in virtual reality, do your surgery before we really do the surgery. And this enables us to make a surgical stent that when we use the surgical stent, we don't have to do flaps and we don't have to place sutures. And what's exciting on John's case, we were able to place 6 implants in approximately 37 minutes. The other surgery you're going to see was the same number of implants were placed, and it was about a 2.5-hour surgery. So I'd like to Dr. Forrest to go over what was the planning entailed, how did you use the computer program to make that template, and what does it mean to you to be able to do a surgery with minimally invasive, the minimally invasive template versus where I've seen you place thousands of implants before we had the technology to do minimally invasive surgery.
The key word I would say is planning, and just making sure that ahead of time that all of the work and the precision of where you want the implants to be in reference to the height of the implants, left or right, side to side. With a 3D CT scan, you can 3-dimensionally plan the case ahead of time. And after you do basically like a virtual reality surgery on a computer, you can have a special template or guide designed for precision placement of where you want the implants to be. Without having to do incisions or flaps or sutures, these things that would cause healing to be delayed and to have more swelling and more discomfort, we're now able to minimize it with minimally invasive surgery so that the case can be done in a quicker amount of time with less discomfort and quicker healing.
most of the discomfort comes from laying the flap of actually peeling the tissue away from the bone. There's very few nerve endings in the bone. So by doing the surgical template and not having to lay a flap, it's like a little wood screw going in a wall. If you've ever placed a wood screw, you know you take an electric drill and it just drills right into the bone. And that's what you're seeing on John's case. So we basically just had 6 small implants that were able, within seconds literally, to drill the implant in. And then what you're going to see, the technique, what I did is I came in and we pre-made John's restoration, and then what you're seeing is we take an impression over the implants, and then my laboratory technician takes about 2 hours to fabricate the parts to that restoration that allows us to anchor that restoration to the implants, and that's why we can do this restoration in 1 day. You know, if I had to ask you, if you had a close family member or a friend and they were having denture problems, now that you're 6 weeks out, you know, how would you recommend this procedure versus, you know, you knew what it felt like to wear a full denture for a year?
Oh, I would recommend it wholeheartedly. The difference is significant. You know, a couple of weeks ago I was out to dinner with my wife, and we were sitting having a meal, and it just occurred to me as I was enjoying my meal that this restoration feels more like my original teeth, but I've got to say better. Better because I'm chewing properly, it's aligned properly, and the kinds of things that I wasn't able to achieve with the removable denture, but most significantly was the sense of taste. I immediately realized when I had that upper denture placed, and I consider myself somewhat of a foodie. I enjoy fine dining and good food, being of Italian heritage, and I missed many of the flavors and the nuances of some dishes.
You know, I know we delayed this surgery because you were going to Italy and you were going to Milan.
That's correct.
And you wanted to eat
Yes.
veal chops, and
Yes.
so you were worried about that if
That's
we did the
correct.
surgery
That's
before,
correct.
you weren't going to be able to eat your veal chop. But in
That's
reality,
right.
you were telling me within a week. Actually, let me ask you this: you had no problem going back to work within a few days, did you?
No, I did not. In fact, if I recall, the procedure was done on a Tuesday, and on Thursday I was back in the office at work, and on that particular day I had my usual 7 hours of conference calls. No difficulty speaking, no challenges in terms of going out to lunch and enjoying a lunch.
Yes.
So yeah, I was back at work within the 2-day period.
You know, your concerns about actually doing this in 1 day, I think you found out we really can do it in 1 day. Mm-hmm. And then your other main concern about the level of discomfort, if you're talking to people, they don't really have to worry about the discomfort, especially when we're doing this with minimally invasive surgery.
Sure. And you know, when I heard that this could be done in 1 day, I was somewhat skeptical.
Yes, I know.
How could all of this very detailed, very involved work be done in less than a day? Essentially, as you said,
Yes.
it took 37 minutes, and
Yes.
I believe I was in your office for perhaps 4 or 5 hours
Yes.
that day. So I was skeptical there, but it is so important that I'm able to enjoy, once again, all of the things that I was able to do prior to getting that removable denture placed.
Well, thank you very much. All right, appreciate it very much. Thanks.